Hi, I'm trying to do this video with the objective to show you what we have developed so far um, for the pain assessment and management simulation that will be used for the dissertation data collection. And as you can see on the screen right now, we have three names on three different rooms. The three names represent each of the three patients that the participants will be interacting with. First, we have Jose Rodriguez, then we also have Lin Chan, and we also have Arthur Smith. Currently in the development process, we have almost completed the design and development of Lin Chan's um, patient room. So what we're going to do is that we're going to go into Lin Chan's patient room and I will show you the interactivity that there is in the room. So what are the actions that the participants will be performing. But first, just to give you an idea of what the participants will do when they enter the simulation environment, they will be in this emergency department hallway. And I will give them a specific order in which they will enter the patient room. In this case, they will left click on the door of the patient room in order to enter. So I will left click on the patient room of Lin Chan. And now I am in the patient room with the patient. And the participants have 360-degree view of the room. And they can also go down or they can go up to a certain level. They don't need to move around the room or anything like that. We wanted to avoid any problems with navigation. So now that the participant is in the patient room, they have to perform some actions in order to conduct their pain assessment and their pain management. One of the very first actions that they will do is that they need to wash their hands. And the way the patients are going to go about doing these actions in the room is that they will click on objects that will allow them to perform these actions. So for example, if you need to wash your hands, the object that you need to click on is on the sink. So you will use your mouse and left click on the sink, and then a menu will come up on the screen, and then they will get the option to wash their hands or they can sterilize the patient room counter. There are some options in the room that the participants will have that will not count towards their performance score. One of them is this one. So if they clicked on sterilize patient room counter, they will get a message saying that they've sterilized the patient room, but that's not necessarily an action that they actually need to perform. They do, on the other hand, need to wash their hands. So if they select wash hands, they receive the point for washing their hands, and then they get a message saying that they have successfully washed their hands. So they click OK. Another options that the patients have, in the room is that they can, sanitize their hands. And the way they do that is that using the hand sanitizer. So they will left click on the hand sanitizer, and again they have an option that they will not receive any points for, which is sanitize patient room. So if they click on it, they have sanitized the patient room. However, they do not need that in order to conduct pain assessment or management. So if they left click on the hand sanitizer, they can sanitize their hands and they will get points for that because they are sterilizing their hands in order to deal with the patient. Now they will right click on the mouse in order to move around the room. So let's look at some other options or actions that they need to perform in the patient room. They need to ask the patient what their pain level is. So the way they do that is by left clicking on the patient's the pain poster. So here they get the message, the patient reported his pain level is 3 out of 10. So they click OK. And then they can move around, and let's say they feel like, oh, in order to do the pain assessment and the pain management, they need to weight the patient. They will left click on the weight, and then they record measurement of patient's weight, and then they get the weight of the patient. It's 135 pounds. You click OK. Another option that they can select that is incorrect but they have the option of doing, and they will not get any points for this, is they can left click on the share, so they can take a break and check your email. So they get a negative message. So it says here you cannot access the hospital Wi-Fi network. And then they click OK to exit that menu. And here are some other options that will help them get some vital signs for the patient. They can left click on the thermometer. So it says here they can obtain the patient's temperature. So they get the temperature for this specific patient, which is 97.2. And they can click OK. And they can also left click on the blood pressure cuff, and they can get the patient's blood pressure. And they get the blood pressure for the patient, which is 120/80. So you can click OK. And they can check the heart rate of the patient by clicking on the cardiac monitor. So they can obtain the patient's heart rate, and then they get an image and a message of the measurement for that patient. Another option that will be available in the final version, but it's not available right now, is that they can left click on the computer in order to access the patient's medical record. And then a PDF actually will pop up on the screen so that they can read the patient's medical record and close it again. Now, let me see what other options we have in the counter. We can left click and get the oxygen saturation rate of the patient. So if they click here, they will get that oxygen saturation rate for the patient. They can click OK, and they can also use the stethoscope to get the respiratory rate of the patient. So if they click in there, they can get the measurement for that patient. And another option that is not one that will provide them with any points is the telephone. If they click on the telephone, they can contact the physician, and then it says the physician is out of the office. So they can click OK. Now, there are other options that are directly available in the patient. So if they left clicked on the patient, they will get, they can see that a patient ID band to identify the patient. So here they get a message saying your patient's name is Ling Shan, and they can click OK. They can click again on the patient, and then they can say they want to see the patient chart. So the patient chart identifies your patient as Ling Shan. So that's another way of identifying the patient. If they click again, we see what it says. They can check the patient's allergy band. This is something that they might want to do before they give the patient some medication. So it says here that the patient is allergic to aspirin. So they click OK. And they can provide some non-medical interventions to the patient. And here they get other options. They can specifically reposition the patient. So they have reposition the patient based on pain location. If I click again for non-medication interventions, they can provide comfort measures. And if I click again on it, they can also encourage slow, easy, deep breathing. If you click